This is Dr. Frank Arya, and today I want to talk about halitosis or odor of the mouth. This is very important, very serious, because a lot of our social lives or relationships or any type of interaction with the people, depends on this matter, because odor of the mouth and halitosis can, affects in our social life. We have to take it very, very seriously. Okay? Be with me. Let's just see what is the reason for halitosis or odor of the mouth. One of the most important reasons for halitosis is oral related or anything related to the mouth, which it could be gingivitis or periodontitis, which is the inflammation of the gum or attachment loss of periodontium, means tissue around of the tooth, or dental caries, poor oral hygiene, tongue, or faulty bridge or ill-fitted bridge, and oral infection. Let's just see how they're gonna work one by one. Be with me. As I said, gingivitis and periodontitis is one of the reasons of halitosis or odor of the mouth because of the bacterial accumulation. Because we have inflammation of the gum and attachment loss because of the bacteria. And this accumulation of the bacteria can cause bacterial byproducts and cause odor of the mouth. If you want to know detail about it, please watch my video about the periodontitis and gingivitis, because I already explained everything about gingivitis and periodontitis, diagnosis, treatment, and everything. Let's just talk about dental caries. As you know, dental caries caused by bacterial plaque. Bacterial plaque is loaded by bacteria. That bacterial plaque is going to attach to the tooth, and bacteria is going to form acid, which that acid is going to destroy the tooth structure. That's how we're going to have dental caries. The most common area for dental caries is interproximal area, means between the teeth, the gap between the teeth, because food can actually trap between the teeth, and bacterial plaque is going to accumulate there. And because of the bacterial accumulation, we're going to have caries there. That's why one of the things we have to do to get rid of or remove the dental plaque between the teeth is dental flossing. Other oral-related reasons for halitosis is poor oral hygiene. Of course, because of the poor oral hygiene, you're going to have bacterial accumulation between the teeth, and you're going to have odor of the mouth. Loaded tongue. Loaded tongue is one of the important reasons we have halitosis or odor of the mouth. If we put tongue under the microscope, we're going to see a lot of taste buds on it. They're like projections. So food get trapped between them, and then bacteria can add on it and cause odor of the mouth. That's why scraping the tongue and hygiene of the tongue, one of the important things after brushing and flossing. Faulty bridge or ill-fitted bridge is one of the reasons for halitosis or odor of the mouth. Why? Because food can get under it and then trap under it, and it's really hard to clean it. That's why bacteria can add on it and cause any type of odor of the mouth. That's why treatment of missing tooth is implant. That's why when you have a choice between implant and bridge, you have to choose implant, because bridge, first of all, can fail because 2 teeth is going to take over 3 teeth, can fail and break. Second, food can get trapped under it and it's really hard to clean it, and bacteria can add on it and cause odor of the mouth. People with 2 or 3 bridge in their mouth, they have a problem with halitosis or odor of the mouth. Why? Because it's really hard to clean underneath, and That's why bacteria can add on it and cause problem. Oral-related halitosis is really easy to solve because, of course, we have to see the dentist every 6 months to do the cleaning. And if the reason is gingivitis or periodontitis, we have to see the dentist every 3 months because we have to do the deep cleaning. And every 3 months, we have to follow the perio maintenance. Please watch my video about the periodontitis and gingivitis because I already explained everything in detail in that video. Of course, besides dental visits, home care matters. There are 2 proper ways for brushing. One is the Bass technique, another is a circular.
The Bass technique for brushing teeth involves angling the brush 45 degrees up or down towards the gum line. This allows the bristles to reach and clean the area of the tooth normally hidden by the gum line. The most common technique is brushing the teeth using a circular motion. With this method, the bristles of the brush do not fully reach the areas between the teeth, so flossing is important after brushing.
Now I want to talk about something very important because even if we do the base technique of toothbrushing, still we are not getting rid of the plaque between the teeth. What does the job? Flossing.
Flossing plays a crucial role in good oral hygiene. Gently insert the floss filament between the teeth with a push and pull motion. Then curve the floss around the tooth and slide it up and down. Repeat this process for each tooth. Remember to never force the floss under the gums to help prevent injury.
One of the most frequently asked questions which my own patient ask me is, "Hey doctor, when I am flossing, I'm bleeding. What is the problem here?" I'm telling them, hey, you know what? You are not doing it the right way. Because when you are actually flossing and bleeding at the same time, that means you put the floss between the two teeth and go all the way down and you're tearing your gum. Basically, you're tearing your gum. That's why you're causing inflammation. Instead of removing the plaque, you're causing inflammation. So what you have to do is you have to put the floss between the teeth and lean the floss to one of the teeth and go all the way down and remove the plaque between the tooth and gum. And then you have to bring up the floss and go to other tooth. Lean the floss to other tooth, go all the way down and remove the plaque between the gum and other tooth. And then bring it up. So that's how you're going to get rid of the plaque. If you put the dental floss between the teeth and go all the way down, you are tearing the gum. Let's just talk about other reasons for halitosis or odor of the mouth, which they are not oral related or they are not related to the mouth. One of the most important reasons for that is upper respiratory tract infection or inflammation, like chronic sinusitis. We have this in Texas a lot because people, they have chronic sinusitis because of the inflammation or infection. So infection or inflammation can cause thick mucosa, and that thick mucosa is bacterial loaded with bacteria, and that cause actually a nasal kind of like obstruction. That's why people, they have post-nasal dripping. They cannot drain from the nose. That's why they have post-nasal dripping. How are we going to get rid of that? So for chronic sinusitis, if you have a bacterial or infectious kind of like a sinusitis, you have to ask your doctor, but the best medication for it is augmentin. That's the best antibiotic for it. But you can ask your doctor or your dentist about it. And of course, you have to get the nasal drips and some allergy medication. For thinning your thick mucosa, the best idea is, this is my experience, I'm going to tell you, is a lavage. Lavage is the appliance. You can put the medication in it and you can put the warm water in it. And it has a two kind of like a nostril. You're going to put in your nostrils. Is from one actually nostril, medication is going to go in, and from other nostril is going to drain out. That's how you're going to get rid of your thick mucosa in your sinus area. And then what's going to happen is your post-nasal dripping is going to get better. This is the best way to go. Lavage is the best way to take care of thick mucosa with sinusitis. Now let's just talk about other reasons for halitosis or odor of the mouth, which more because of the systemic disease, because mouth is the first actually part of digestive system. So diabetic is the one of the reasons for halitosis because of the systemic disease, because we cannot have a sugar breakdown. So that's why these people, they have a fat breakdown, and then they're going to have ketonic kind of smell in their mouth. Kidney problems because of the low fluid intake, they're going to have more dry mouth, and because of the dry mouth, we're going to have more kind of bacteria accumulation, and then we're going to have odor of the mouth. And Sjogren disease because of the salivary gland, which we have a parotid, and then submandibular and sublingual. If we have any type of autoimmune disease or any type of problem with salivary gland, we're gonna have a dry mouth, and because of the dry mouth, we're gonna have odor of the mouth. And depression, because of the nature of the medication. Depression, we are taking a lot of medication which they can cause dry mouth. And then because of the dry mouth, again, we're going to have halitosis or dry, odor of the mouth. Cirrhosis, which is the liver disease, of course, with the liver disease, because of the lot of problems, because of the liver is a factor of the body. That's why when we have a cirrhosis, we're going to have a lot of problem with, digestive system, which mouth is the first part of the digestive system. That's why we're going to have for sure odor of the mouth or halitosis. And cancer, again, cancer because of the chemotherapy and radiotherapy. Of course, we have dry mouth again, and then we're going to have odor of the mouth. Thank you for watching this video. I know this is not really medical issue. This is more social issue. A lot of relationship is because of this, and a lot of divorces actually happens. Please ask your questions. I can make a video out of it, and see you around.